Yeah, there's many different implications that our project could potentially have. Of course, antibiotic usage is something that is a huge concern across many different countries. Antibiotic usage is a huge concern, especially with huge rises in antimicrobial resistance. And I think our study findings, taking into account that early onset colorectal cancer and even later onset colorectal cancer, antibiotic usage is so widespread, it's hard to tell whether this correlation we've seen is actually a causative relationship. Our findings provide further reasons for physicians and members of the public to want to reduce antibiotic consumption. I think when you look at the numbers of people exposed to antibiotics, it really is huge. In fact, in the USA, more than 70% of infants under 2 years of age are exposed to antibiotics, and that's at a very young age. And we have no idea what implications that will have on your gut microbiome. I think the gut microbiome personally is something which is incredibly complex, and we can't even begin to comprehend how it works and all the implications using broad spectrum antibiotics may have on that. We do know that dysbiosis caused by certain microbes overproliferating and monopolizing metabolic resources and producing byproducts then can interfere with normal human cell functioning and cause then further microbial imbalances to occur. And then this vicious cycle then continues. And this doesn't just give rise to potentially colorectal cancer, but also a whole host of other diseases like inflammatory bowel disease, allergic diseases, and then also obesity, especially childhood obesity. I don't think that, if 70% of, or over 70% of children aged less than 2 in the USA are being exposed to antibiotics, I doubt that that's necessary use. Of course, antibiotics are very important, powerful drugs, which, often are indicated and essentially do save lives. However, I think we should be very careful how we use them. Of course, there's different things at interplay as well, like our diet and having high calorie, low density, low nutrient density diet can give rise to many, many different diseases, including colorectal cancer. And I think there's many different factors at interplay here. But I think certainly antibiotic usage should be reduced if possible. Further to this, I think our findings also could make a change to the referral process. Dr. Leslie Samuel, one of the consultants I've worked with in oncology, he suggested that our findings could actually have a role in changing the kind of proformas which are used to refer patients from primary to secondary care. If we could include antibiotic prescribing history in that proforma, it would give gastroenterology quite an interesting thing to look at when they are investigating patients for colorectal cancer, because of course this is something which is not routinely collected. We look at smoking history, alcohol history, which although are highly relevant, we think actually antibiotic usage would be something that would be really interesting to look at here as well. So I think as well, further to our findings, we are, as far as we're aware, and to date, we are the first study which has looked at the association between antibiotic consumption and early onset colorectal cancer. And we need further studies to evaluate our findings and take this further. We did have a relatively small sample size, even though we tried to use such a big data set. So we do need larger centres to try and kind of see if their findings are the same as ours and whether there is quite a big difference between early onset and late onset colorectal cancer in terms of epidemiology.